I was young. I was 19 years old. I did a combat tour of the 1st Infantry Division, and I think probably the hardest thing for me was being that young and being exposed to all of the things that were going on in Vietnam at the time and just being unprepared. Now, that was a different army. When I came back, I got out of the Army when I came back. 24 hours after I landed in the United States, I was out on the street in civilian clothes, and that was it. That was my, no one ever said, hey, are you doing okay? But the consequence to that was, for many of us, 15 years later, we had issues that we were still dealing with that were unresolved, and that was a period of time when a lot of attention was devoted to post-traumatic stress disorder and other issues that do affect combat veterans. Anytime someone is in a combat operational area, I don't care what their job is, it's stressful. Just the idea that you're in danger all the time is stressful. Even if you're not shooting or being shot at, it's stressful just to be there. And the more combat exposure someone has, the more stressful it can be. Get to know your soldiers, number one. There are many risk factors that we can definitely identify that contribute to someone being at risk for trying to hurt themselves or commit suicide. Financial issues, financial stressors, UCMJ actions, relationship problems, substance abuse issues. But the key factor is a change from a previous level of functioning. So, for instance, you've got a soldier who's been a great soldier, hard charger, great performer, and then lately you start to notice, wow, he's not doing so well on the job, and gee, maybe he's not taking care of himself so well. Looks like, his clothes look a little bit more disheveled. Maybe he's not shaving as much, and seems to be keeping to him or herself more than it had in the past. Doesn't seem to be interested in a lot of things. Maybe the drinking has increased from where it had been before. Gets a DUI where, that would have been unheard of before, and starts to engage in high-risk activities that are unusual for this particular individual. Find out what's going on with that soldier and ask the tough questions. The tough questions are, hey, are things so bad for you that you're thinking about hurting yourself? Are you having some thoughts about suicide? And even if the answer is no, it's prudent to try to get that soldier to get some help. Let's face it, our soldiers are tough. And it's hard for tough people to ask for help. And often, people around the individual who needs help are the first ones to recognize that there's a problem. There's a myth out there that if you ask someone if they are thinking about committing suicide, that this will somehow impel them to commit suicide. It'll make them more likely that they'll commit suicide. And that's absolutely not true. Someone who's contemplating suicide attempt is stressed by that, and the fact that someone would actually ask them that question can be a huge stress reliever. It's like, wow, the cat is out of the bag now. Someone recognizes something, and I have the opportunity now to go for help. We also need to not criticize and not think less of someone who needs help or is asking for help. I can be pretty much assured that there are leaders out there listening to this who are thinking to themselves, if I have a soldier who needs behavioral health care, that's a broken soldier. We need to get over that. We need to get the message out that behavioral health care is no different than any other type of health care. War changes people, and repeated exposure to war will change people. It is not unusual for people to come back from multiple deployments and have some issues with combat stress that they need help in dealing with. We need to make sure that if someone is struggling with those issues, that we are available to provide help. Every unit has a chaplain that's available all the time, and in many cases chaplains really take the lead in suicide prevention. There are the military family life counselors who don't keep records. A lot of people like that. There are the behavioral health specialists in our behavioral health clinics, in our schools. But it's important that leaders, once they identify someone who may be in trouble, to get them to the care and the help that can help resolve their problems. And it's important to take them, not to send them, to take them. That demonstrates the commitment and the caring that leaders have towards their soldiers. I would